It might be shocking to learn that a regular diet of the wrong types of nuts could elevate your chances of developing cardiovascular disease by a staggering 48%, a risk that is especially pronounced for senior citizens. There's a scientific basis for that number. It stems from extensive research conducted over many years and published in the prestigious Journal of the American College of Cardiology. And here is the truly unsettling part. Some of the most widely consumed nuts, likely sitting in your kitchen cabinets right now, can silently contribute to higher blood pressure, trigger inflammation, lead to arterial blockages, and even accelerate cognitive decline. Despite this, a large number of seniors consume them under the belief that they are beneficial for their health. One nut in particular, which we will identify later in this video, has been linked to significant levels of a toxic compound that, with consistent consumption, can cause damage to your liver, kidneys, and even your cognitive faculties. It's highly probable you have this exact nut in your pantry, the very one often promoted by low-carb diet enthusiasts as a healthy choice, yet it could be inflicting lasting harm on an aging body. But do not worry, we are here to guide you. This video serves as the definitive manual for nut consumption, detailing which nuts are the safest, which are optimal for your heart health, and which provide the greatest benefits for your brain. We will also cover which nuts you ought to steer clear of completely. Furthermore, it is crucial to watch until the very end, as we will uncover a hidden truth about the #1 most hazardous nut, a fact that few people ever mention and which could be causing serious damage to your health without you even realizing it. Before we dive in, please like this video and subscribe to our channel to receive more health-focused content. Also, let us know in the comments section where you are tuning in from. Without any further delay, here are the 4 essential types of nuts that seniors should incorporate into their diet. Fourth, the bone-strengthening powerhouse, almonds. For an aging body, one of the most beneficial foods you can eat is the almond. This is due to the almond's impressive concentration of calcium and vitamin E, a combination that works together to maintain strong and resilient bones. As we grow older, our bones naturally become more porous and brittle, making fractures a much more serious risk. The natural process of bone loss accelerates after the age of 65, but consuming just a quarter cup of almonds each day can help to decelerate this process by delivering around 97 milliliters of calcium. What makes almonds truly exceptional is that they are not only packed with calcium, but also with magnesium, a vital mineral that many older adults are deficient in. Magnesium acts like a traffic controller for calcium, ensuring it gets delivered to your bones where it's needed, rather than building up in your arteries where it can cause harm. Additionally, the heart-healthy monounsaturated fats in almonds help to reduce levels of bad LDL cholesterol, a critical benefit as the risk of cardiovascular issues rises with age. My professional recommendation for seniors is a daily portion of 15 to 20 almonds, preferably consumed raw or dry roasted without any added salt. Furthermore, almonds are an excellent defense against constipation, a condition affecting nearly 40% of the elderly population, thanks to their high fiber content of about 3.5 grams per serving. Most importantly, research from scientists at Tufts University has demonstrated that almonds can help shield brain cells from the oxidative damage that is a major concern with aging. For maximum benefit, choose almonds that still have their skins on, as the skin contains flavonoids that, when paired with vitamin E, double the nut's antioxidant power. A word of caution, almonds can pose a choking risk for seniors with swallowing difficulties, so always chew them thoroughly before swallowing. Thirdly, walnuts, the nut that enhances cognitive function. With their remarkable visual similarity to the human brain, walnuts are celebrated as one of the premier brain foods available to seniors, nourishing the very organ they resemble. These incredible nuts are the single best source of the plant-derived omega-3 fatty acid, alpha-linolenic acid, ALA, outranking all other common nuts. This is profoundly important for the aging brain, as omega-3s are essential for facilitating neurotransmission and preserving the integrity of brain cell membranes. A recent study featured in the Journal of Nutrition found that seniors who consumed just 1.5 ounces of walnuts daily for a period of 8 weeks experienced notable improvements in their cognitive processing speed and mental agility. The unique polyphenolic compounds in walnuts are thought to slow the advance of neurodegenerative conditions such as Alzheimer's and dementia because they can cross the blood-brain barrier to fight inflammation directly within neural tissues. A lesser-known fact is that walnuts are a natural source of melatonin. Since melatonin levels tend to decrease with age, leading to sleep disturbances for many seniors, a small handful of walnuts before bedtime can help promote a more restful night's sleep. Walnuts are also exceptionally good for cardiovascular health due to their combination of arginine, an amino acid that supports healthy blood vessel function, and polyphenols that reduce oxidative stress. In fact, for seniors on blood pressure medication, walnuts can even boost the effectiveness of the medicine by helping to maintain the flexibility of their arteries. For the best results, store walnuts in the refrigerator to protect their fragile oils from turning rancid. Aim to consume 7 to 9 walnut halves each day. As a bonus, cracking them open yourself can be a great way to maintain your fine motor skills. Don't be deterred by the slightly bitter taste of walnuts. That bitterness is a sign of their powerful antioxidant content. Secondly, pistachios, an excellent way to manage blood pressure. When discussing the health advantages of nuts for seniors, pistachios are perhaps the most underappreciated, particularly for their role in blood pressure regulation. What sets pistachios apart is their ideal mineral profile. They are naturally low in sodium while being high in potassium, offering about 285 mg per serving. This balance is crucial for older adults, as it assists the kidneys in flushing out excess salt, a function that can become less efficient with age. This effect can help lower systolic blood pressure by 3 to 5 points, similar to some prescription drugs but without the associated side effects. Furthermore, the lutein and zeaxanthin found in pistachios deserve special mention. These carotenoids accumulate in the macula of the eye, offering protection against age-related macular degeneration, which is the leading cause of vision loss for people over 60. Seniors can savor the satisfying crunch of pistachios without the same risk to teeth and gums that harder nuts might pose. Their distinctive green and purple coloring is not just visually appealing, it signifies the presence of antioxidants that combat free radicals, which accelerate the aging process throughout the body. The practicality of pistachios also makes them ideal for seniors. The physical act of shelling them slows down the rate of consumption, preventing overeating and creating a mindful eating practice that can be both calming and mentally stimulating. Research published in the International Journal of Obesity has shown that the sight of the empty shells serves as a visual cue, helping seniors to better regulate their portion sizes. If you have arthritis in your hands, you can still reap the benefits by looking for pistachios that are already partially opened. Aim to eat about 49 pistachios daily, which is roughly 1 ounce of unsalted or lightly salted nuts. For the 25% of Americans over 65 who are diabetic or pre-diabetic, the 3 grams of fiber per ounce is incredibly valuable for managing blood sugar levels. First place, Brazil nuts, a solution for thyroid health. We have placed Brazil nuts at the top of our list because of their profound impact on thyroid function, a critical yet often overlooked aspect of healthy aging. These remarkable nuts are the most concentrated food source of selenium known, with a single nut providing 96 micrograms or 137% of your daily recommended intake. This is incredibly significant because up to 20% of individuals over 65 suffer from thyroid disorders, many of which go undiagnosed because their symptoms are commonly dismissed as normal signs of aging. Selenium, which is so plentiful in Brazil nuts, is essential for activating thyroid hormone, which in turn governs energy levels, metabolism, and mood regulation. Beyond thyroid support, the unique fatty acids in Brazil nuts contribute to the maintenance of myelin, the protective sheath that insulates nerve cells and tends to degrade with age. This myelin preservation can help seniors maintain their reflexes, reaction times, and cognitive processing speeds. Interestingly, the selenium in Brazil nuts is organically bound, which makes it more bioavailable and easier for your body to absorb compared to synthetic selenium supplements. Brazil nuts are so potent that you only need a small quantity to experience their benefits, and their rich, creamy flavor makes even a small portion feel satisfying. In fact, I recommend that seniors limit their intake to no more than 1 or 2 Brazil nuts per day, as excessive selenium can have adverse effects. When purchasing Brazil nuts, opt for those still in their shells, as this natural packaging helps preserve their nutrients for longer. Due to their high fat content, store them in the refrigerator to prevent them from spoiling. As an added benefit for seniors who struggle with constipation, the combination of fiber and natural oils in Brazil nuts helps promote regular bowel movements. Their naturally sweet and buttery taste makes them a fantastic substitute for less healthy snacks. Most impressively, emerging evidence indicates that certain antioxidants in Brazil nuts may help slow the natural shortening of telomeres, the protective caps on our chromosomes that shrink with age, thereby influencing the rate of cellular aging. If you are 65 or older, these nuts are an outstanding addition to your diet. Nuts to approach with caution. In this next section, we will cover nuts that some seniors may want to limit or avoid entirely. Number 4, the inflammatory trigger, peanuts. Despite their immense popularity, peanuts present several potential problems for older adults. To begin, it's crucial to know that peanuts are not true nuts. They are legumes that grow underground. This environment makes them susceptible to mold and aflatoxins, which are mycotoxins produced by certain molds that can damage the liver and elevate cancer risk with frequent consumption. As we age, our body's natural detoxification systems become less efficient, making this risk even greater. Even more concerning for seniors, the proteins in peanuts can provoke inflammatory responses in many people, even without a formal allergy. For aging individuals who are already at a heightened risk for joint pain, cardiovascular strain, and cognitive decline, this kind of low-grade inflammation can exacerbate all of these conditions. The high omega-6 fatty acid content in peanuts also contributes to an imbalance, as most American diets are already too high in omega-6s relative to anti-inflammatory omega-3s. Many physicians fail to mention the dangerous interaction between peanuts and blood-thinning medications like warfarin, which can be affected by the vitamin K in peanuts. Commercial peanut butters often compound these issues by adding hydrogenated oils, excess sodium, and sugars, which are particularly harmful to aging cardiovascular systems, a major concern for the 63% of American seniors with hypertension. Another problem is that peanuts can go rancid if not stored correctly, producing harmful free radicals. The common commercial practice of dry roasting peanuts also creates acrylamide, a chemical with potential neurotoxic effects, which is especially troubling for those concerned about memory loss. Even if you have been consuming peanuts without issue, swapping them for one of our recommended nuts just 3 days a week can provide superior nutrients while reducing your exposure to these risks. Third, cashews, the deceptive sugar spiker. Cashews present a unique danger to seniors because of their high carbohydrate content and significant glycemic impact. Compared to true tree nuts, cashews contain more carbohydrates, about 9 grams per ounce, and fewer protective fibers and compounds. For the approximately 25% of people over 65 with diabetes and the additional 48% with prediabetes, this can trigger a harmful blood sugar spike. This is especially problematic because cashews have a healthy reputation, leading many seniors to consume them in large quantities without considering their effect on blood glucose. The smooth, curved shape of cashews also makes them a significant choking hazard, a danger that should not be underestimated for those with swallowing difficulties. In fact, they are one of the most frequently aspirated nuts among the elderly. From a nutritional standpoint, cashews are high in oxalates, which are compounds that can bind to calcium in the digestive tract and inhibit its absorption, a serious issue for seniors already at risk for osteoporosis. These same oxalates dramatically increase the risk of developing kidney stones, a risk that already rises significantly after the age of 60. There's another hidden issue with cashews: the processing. To remove urushiol, a toxic substance also found in poison ivy, cashews undergo extensive processing that diminishes much of their nutritional content. Many store-bought versions are then oil roasted and heavily salted, adding unhealthy fats and sodium that can worsen blood pressure and cardiac stress. A little-known fact is that cashews contain enzyme inhibitors that can interfere with protein digestion, a particular problem for seniors who often already face challenges with food digestion and protein absorption. The creamy texture of cashews makes them very easy to overeat, potentially contributing to weight gain at a time in life when maintaining a healthy weight is increasingly difficult. Regularly substituting walnuts or almonds for cashews will provide a healthier snack with superior nutritional benefits and fewer risks for aging bodies. 2. Macadamia nuts, the calorie-dense health risk. Despite their luxurious taste, macadamia nuts are a significant health concern for the elderly due to their extreme calorie density. They are the most calorie-dense nut available, packing around 200 calories in a single ounce. Since metabolic rates naturally decline with age, this adds another layer of difficulty to the already challenging task of weight management for seniors. Their exceptionally high fat content, around 22 grams per ounce, can also overtax the gallbladder, which is already less efficient in older age. For the 15% of seniors who have asymptomatic gallstones, macadamias can trigger painful attacks that might otherwise have remained dormant. Beyond the sheer calorie count, macadamias have one of the highest saturated fat contents among nuts, at about 3 grams per ounce, which can contribute to elevated LDL cholesterol levels, something many older adults are already trying to manage. Their dense, hard texture poses a tangible risk to the dental health of seniors, especially those with crowns, bridges, or brittle teeth. This is a growing concern for individuals over 65, as tooth enamel naturally weakens from a lifetime of use and reduced calcium absorption. From a practical standpoint, macadamias are one of the most expensive nuts. This might lead budget-conscious seniors to opt for lower-quality versions that are more likely to be rancid or improperly stored, exposing them to harmful oxidized fats. The nutritional profile of commercially available macadamias is often worsened by oil roasting and excessive salting, which adds more sodium and damaged lipids. Their rich, buttery flavor can easily lead to overconsumption, especially for older individuals whose taste perception may be diminished, causing them to prefer more intense flavors. It is concerning that many seniors eat macadamias believing they are good for their heart, when in fact, most research showing the heart health benefits of nuts has focused on nuts other than high-fat varieties like macadamias. If you regularly enjoy macadamias, consider switching to pistachios, which offer a vastly superior nutritional profile that is better suited for the needs of an aging body. First, pine nuts, the notorious medication disruptor. Topping the list of problematic nuts for the elderly are pine nuts, which are troublesome for several reasons that are particularly acute for this demographic. The most alarming issue is that they contain compounds that can interfere with over 60% of the medications prescribed to seniors. This means the effectiveness of these drugs could be reduced, or dangerous side effects could be introduced. This interaction is especially common with statins, certain antidepressants, and blood pressure medications frequently prescribed to people over 65. Alarmingly, this risk of food-drug interaction is rarely, if ever, mentioned by most doctors or pharmacists. The most peculiar concern is pine nut syndrome, a condition where consuming pine nuts can induce a bitter, metallic taste that persists for weeks. While this might seem like a minor annoyance, it can have devastating consequences for older adults, as taste alterations are strongly linked to decreased appetite and poor nutritional intake. Studies show that up to 42% of those affected experience a significant loss of body weight. The syndrome appears to be more prevalent among the elderly, possibly due to age-related changes in taste receptors and detoxification pathways. Pine nuts are also rich in polyunsaturated fats that can oxidize very quickly, creating inflammatory compounds. This is a major concern for seniors who are already managing inflammatory conditions like arthritis. Their small size and slick texture create a risk of aspiration, which is particularly dangerous for older adults with swallowing difficulties or medication-induced dry mouth, a condition affecting over 70% of seniors on multiple prescriptions. At a time when the body's ability to absorb protein is already naturally declining, the enzyme inhibitors in pine nuts can further impede protein digestion. Finally, due to their high oil content, pine nuts are a calorie-dense food that can contribute to the weight management challenges common after age 65, even when used in pesto, their most frequent culinary role. Disturbingly, emerging research is linking compounds in certain pine nut varieties to an acceleration of age-related macular degeneration, the leading cause of blindness in the elderly. These 4 nuts are best avoided after the age of 65. The dietary decisions a person makes, which nuts to embrace and which to avoid, can have a profound influence on their health, vitality, and cognitive function during their senior years. Ultimately, remember that it's the consistent application of small, positive changes that leads to significant long-term results. Now it is time for you to share your experience. Have you observed any effects on your health from dietary adjustments, such as adding or removing specific nuts? Tell me, which nut has made the most noticeable impact on your life? Please post your thoughts and personal stories in the comments section below. We greatly appreciate your input.